Intermountain Health is improving the health of our community in such a variety of ways.
We have Mikkel Moore, who is the Chief Community Health Officer for Intermountain Health, here to tell us how they are working to improve access to care in the community in the sponsored interview. Well, welcome.
Thank you. I appreciate the opportunity to be here.
Well, there was this report that comes out annually of this call to action of improving community health. What did you guys find?
So we do a community health assessment every 3 years formally, where we're listening in every community we serve for what are the issues communities are facing in trying to be healthier, and what are they looking to health systems and other collaborators to try to solve. And we learned that the things that are most important to people right now in every community is mental health, mental health, mental health. I mean, honestly, that's the thing top of mind for everybody. But in addition, they're saying things like our food and nutrition access to affordable housing, other issues are influencing our mental health and our stress. But we're also trying to stay healthy in terms of injury prevention, and we're really concerned about air quality.
So you look at those things and then you come up with some solutions and what you're doing to improve access to that care. And the first one is providing more than $189 million to patients in financial assistance and charity care.
We think it's pretty fundamental, actually, that if you need health care, you should have access to it regardless of your ability to pay. And that's kind of a tenet of Intermountain Health's commitment to the community. But it has to go deeper than that, because at the point we're accessing care, particularly in an emergency room or a clinic, we're already not living our healthiest lives, most likely. And so we're also trying to think about, yes, how do we create that safety net, but how do we move further upstream to help keep people healthier before they need care?
And Mikkel, part of that is access to care, and you've developed this voucher system in the clinics. How does that even work?
So there's a large safety net of community-based clinics that aren't operated by Intermountain Health. We partner with 50 in our community that are independent but have the ability to use this voucher system to refer directly to Intermountain for any services they don't provide, whether that's lab testing, diagnostic services, specialty care, or hospital services.
And this goes right along with that one. You've also supported community health clinics for low-income patients.
So we operate some of our own clinics and support a lot of community clinics who create access that can be free or very low copay for getting access to primary care, so people can keep themselves healthy.
And continuing that access and care, Rose Park has a clinic, but you've also partnered with the school.
So we know that oftentimes people feel barriers to accessing care that go beyond just being able to afford it. They don't know what they need, they don't feel safe. A school is a place that communities trust. It's in their neighborhood, are often going there anyway, and have developed a relationship. So we have a clinic in the elementary school that can also be accessed without going into the school, but it creates a feeling of safety for communities to come there.
Also provided those vouchers, finally, for more than $16 million to low-income patients for those key health services. Are they accessing them more?
Yes. We find that if we place the access within those community clinics, in schools and other settings, then that provider that they've developed a relationship with trust uses the voucher to refer to specialty services at Intermountain.
Going back to mental health care, Utah, this is astounding. And not surprising because we've talked about it, but Utah ranked 9th in the United States by the CDC with the highest rate of suicide. What are we doing to curb that statistic?
Suicide prevention is really complex, and there's lots we've learned in the last few years about things we can do to mitigate the risk. First, we can reduce the likelihood that someone makes an attempt at suicide, so access to mental health services, talking about mental health and well-being. Even in the conversations you host here, we make talking about our feelings, our emotions, our mental well-being more accessible. And so we've invested in the Live On campaign around improving the dialogue that we're having, the destigmatizing, accessing mental health services. But we've also learned in this part of the country that the accessibility of firearms creates an additional risk for our community. Not because firearms are necessarily a bad thing. We use them in hunting, self-protection, et cetera, but when they're accessible when someone's in crisis, it creates a really lethal means for solving problems. And so we are distributing gun locks, educating on the importance of securing guns safely, and even intervening. When we know a family's going through crisis, we can offer to babysit their guns, if you will.
I think this is important. In 2021 alone, more than 8,700 free gun locks were distributed in Utah, and you've trained more than 33,000 providers and caregivers on suicide prevention tactics.
Just talking about the importance of securing firearms saves lives. And so we've armed a lot of people with that education, but also with tools.
I'm glad we're talking about it right now. Good.
Me too.
The more the better. Intermountainhealth.org, everybody, for more on this sponsored content. You can also go to our website, abc4.com/GTU, and our thanks to Intermountain for this sponsored interview.
Thank you, Mikkel, so much. All right.